Yes, 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 yes. This is another day in paradise. Music crying, one love, one heart. Let's get together and feel alright. Let's get together. Yeah, this family. One heart is a place for the hopeless sinners who can turn of mankind to the creation. One heart, and the music sighing. One heart. Yeah. Yes, my guys. Welcome everyone. Welcome to my channel, The Wise Guy. Welcome to this channel where we usually do good things. Good things means we talk about good issues. So we are still continuing. Catherine, say hi. Catherine, how are you doing? Which state are you texting from? Hope you are doing good. This is Benjamin the Wise Guy. Hope everyone that is watching has subscribed and is going to like the video that we're going to do today. You know, here we talk about health matters. We advise each other about mental health. We discuss about good things, and then we feel nice every time. You know, sometimes when you have time and you're perusing through your phone, you better get a place you can chill off and release the stresses that you've been having through the day. And you know what? Benjamin the Wise Channel is that place, you know. I can see Catherine, I can see Jamaican uncle have already said blessings to you, Dr. Benjamin, and everyone in the platform. Yeah, man. A big man, I say so. Yes. We are still continuing and talking about heart conditions. Still continuing and talking about heart conditions. Mostly what we're going to talk about is other types of heart attack. And you know, before I started doing this thing, I usually sing and say a song to relieve the pleasures of life. You know, like you just say, one heart, say one love. Let's get together and then sing, all of us, and sing all of us. Hear the music coming. Atom ZW, I'm still welcoming people before we continue with our talk. I can see Atom Z10W checking in the house and saying hi. Atom, big up yourself. Hope you're coming in and subscribing. You know, when you subscribe, you will get some notification telling you, hey, what up? What up? Benjamin the Wise Guy is live. The good vibe person. I'm Brazilian. Hey, that's nice. Good one. I'm coming from Kenya, Atom ZW. I'm a Kenyan doctor and I like sharing some healthy tips around here. You know, I like sharing healthy tips around here, man. And your support is good. When you come here, we discuss and we help each other grow in a good way. That is the best thing that can ever happen to everyone. You know, good mental health and good stable mental health. You see that Atom 10W, welcome to the channel. Welcome everyone who is watching. And if you are there, you have something medical, you have something that you need to discuss, you want to know more about it, don't worry yourself, man. Don't worry yourself, because the doctor is here. Dr. Ben out, Benjamin the Wise Guy channel. You see, my friend already kicked in the house. The coffee cake loving Bishop. Big up yourself, Empress. Big up yourself, Empress. It's been a while. We haven't talked. It's been a while we haven't talked, but yeah, I can see you're here and I know you are well. Hope you're doing good and you're doing better than more before. You know, we get the healthy tips. We have some good friends that are coming, so we discuss. We are still continuing with heart attack, migraines. Coffee cakes, I don't like headaches. Where are the headaches hitting you from? Front, temporal region, or you know, we discussed about migraines, we discussed about cluster head, discussed about, you remember the types of cephalagias, autonomic type cephalagias, migraines, where are they? If they are temporal sides coffee cakes, please take some paracetamol and use sumapritan. That one would help. That one would help, and take ample amount of water if they are. But you need to take rest, especially when you are feeling you're tired, and especially when you are feeling you are overthinking or overworking for migraines. Sorry about that. Catherine, you're still here. Thanks a lot. I know you have subscribed. Welcome to this chat. Welcome to this channel. Creeps from the back of the neck and right behind my left eye. Need up urgent care. They gave me a shot. Yes. When they come from this side, creeps from the back, temporal lesions, those ones are called cluster headaches. They are type of migraines, but they are called cephalagias. So shots are important, but you need to stay away from bright lights. Use sometimes shades. Use shades, and also use serotonin agonist tablets. Serotonin agonist. Sumapritan is widely used. I was vomiting, dizzy, and could not see. Yes, those are cluster headaches, cluster cephalagias, cluster autonomic. You need to use sumapritan. You need to stay away from loud noise and bright lights and take rest. Coffee cakes, I'm sorry for that. I don't like you getting headaches, and when you feel bad, you have my number. Our coffee cakes, you text me and tell me, my doc, man, I'm not feeling well. Then as you get treated, I can advise more. But we thank God you got help. We thank God you got help. Catherine is laughing. Hey, Catherine. Catherine is a new guest today, and Catherine is feeling better, Catherine, which country are you coming from? Yes, they gave me sumapritan shot. Yeah. They gave you sumapritan because it is a serotonin agonist. When serotonin comes out, substance P from the nerves, and then there is something that is called there are three chemicals that nerves release. They are suppressed. Okay, so we continue, and I may need to go back on it, but it gave me heart flips. No, you taper off slowly by slowly. You get the tablets, but taper off slowly by slowly. You get it? Taper off slowly by slowly. So don't just go. Just a minute. If you're coming in right now, please join the chat. Tell us where you are watching from, and tell us where you are chilling from. Where you are chilling from, so that we can interact. Look at beautiful people that are texting on the chat, and a good friend like the coffee cakes is here. Coffee cakes, I missed you. I didn't know you were feeling bad, but thank God it is recuperating. Jamaican uncle, big man, bless up every time. Jamaican, hi, thank you. I'm okay right now. First a few days already. Oh, nice. Let's talk about something that is they are called. I was talking about the headaches, and what I was looking for is trigeminal autonomic cephalagias. Yes, as I'm replying to people, we are coordinating here and we are talking. There's some things that we need to understand as we talk online. We help each other. If I'm a doctor and you have experience, we need to interact so that we make the society better. As a doctor, I have the knowledge. As a person who has experience, you also have the knowledge. You may help someone. So come to the chat and tell us, this is what I feel about what you have said, and we interact and we say this is what we can do. No, we were talking about heart attack. And We talked about heart attack. Let me talk about heart attack in perspective of the electrocardiogram. If you have not seen that video yesterday, we have talked about heart attack concerning the ECG. So there are some types of, you remember, let me get this. I showed people this. This is the lines that you see when you look at the electrocardiogram. And we talked about ST elevation. ST elevation, if you see ST has elevated like this, you know, this is not normal. This is saying that your heart is not getting enough oxygen. This is normal on the BAT machine. So we talked about it yesterday, and we said heart attack are categorized into two concerning the myocardial infarction, ST elevation and non-ST elevation, whereby, you know, if ST is elevated, J Hank, welcome to the platform. Big up every time, my friends. If you come and you are watching, please don't forget to hit the like button, man. Don't forget. And if you are a new person, man, you do what you have to do, man. You hit the subscription button, man. Subscribe so that you can be getting instant notifications, you know. Hit that. J Hank is saying, greetings, family. Greetings, J Hank. So, yesterday we categorized heart attacks in a perspective of ST elevation and non-ST elevation. And the ST is these waves that you see on the electrocardiogram. This is the ST, whereby the heart muscles have contracted. Let me show you this heart here. Let me show you this heart here. The heart muscles have contracted. The P wave has come. The PQRST has contracted. But there is a problem in relaxation of this heart. There is a problem whereby this heart cannot relax and come back to normal better so that it can pump again. It means the coronary vessels, the blood vessels that are here. I'm just giving a recap of yesterday. It means that the blood vessels, when the heart pumps blood, what happens? This right ventricle pumps blood to the lungs, and this left ventricle pumps blood to the body. And while it's pumping blood to the body, what happens? The coronary arteries, right and left, brings again oxygenated blood to the heart muscles. So when it is pumping and you have less oxygen, because the coronary arteries here have been blocked, these coronary arteries here have been blocked, what happens? It means your heart muscles will not have energy, because oxygen gives you energy for metabolism and stretch. So if you don't have oxygen, it means the coronary arteries are not passing blood well. So you will get something like this. You'll get something like this one here, the ST, that has either elevated or either gone down. So Okwemba is here, my namesake Okwemba is here. Okwemba, welcome to the platform. I know as you come in, you hit the like button and you tell other people, hey, the mentalist, the reggae man, the doctor himself, who injects some good knowledge and enjoyment. You know me, I inject to people knowledge about medicine, and I inject again some enjoyment. You know, I'm the doctor of enjoyment and treatment. So welcome to the platform, everyone. I can see you are watching me and feeling nice. As you watch me and feel nice, have you subscribed to this channel? Check. Hit the like button, my friend. So let's continue. So that one is what we did yesterday. If you need details, there is a video we did yesterday. Go back to that video and you will get enough of knowledge. So let's continue right now to the other important issues. Let's continue right now to the other important issues. And what are the important issues? I say the most important issue here is, one, other types of heart attack. Because yesterday we discussed, this one explaining to people how this ECG came. It had to take some time. It had to take some time telling people how we place the probes, how these waves come, what is P wave. You can go to the video and go slowly by slowly. But now today we are talking about randomly everything. And if everyone is here and watching, I want to tell everyone, please give a hug to my friend the coffee cakes. The coffee cakes have not been feeling well. Migraines have been a problem. So let's give a hug. Everyone who is here, let's give a hug to coffee cakes. Coffee cakes, get my hug. Relax. God is watching and you'll be okay. Feel nice. We pray that you'll be okay and healthy. So if you are watching me and you know the coffee cakes is one of us, let's send some hugs to coffee cakes, my friend. Let's get some soothing hugs, some soothing words, so that coffee cakes can relax, man. You are here, and coffee cakes is one of our sister here. Marge is in the house. Let's give coffee cake some hugs, man. Some hugs, and pamper her so that she can calm down. She can calm down, man. She can calm down. Yeah. Thanks so much for those that will send messages of relaxation to her. I'm waiting for those messages. I'm really waiting for them. Now, my good friends, today we are going to talk about universal definition of myocardial infarction. We are going to go from type 1 to type 5. Jamaican uncle, that's amazing work also supporting Doc. Hey, J Hank. Me and Jamaican uncle, we come from Tough Gong. J Hank. Please ask Jamaican uncle where Tough Gong is. When you hear about Tough Gong, this is where the song started, where the song was played. This song was no woman, no cry, no woman, no cry. Then I remember when we used to stay in a tenement yard in Trench Town. You already know where that song came from. No woman, no cry. No woman, no cry. The king of reggae himself. Bob Marley himself sang that song. You are watching me today. This is Benjamin the Wise Guy out at the channel. Dr. Ben is my name, and today we are talking about the other types of heart attack. Have you subscribed, my friend? Have you subscribed to this channel? Don't just walk away, you don't just swipe. When you swipe, you can like singing. When you are swiping to a channel like this and going, and let me welcome people as I entertain a bit. You are kind of like singing, I'm walking away from the troubles in my life. Craig Davis, I'm walking away to find a better place. No, don't swipe away. Don't swipe away. What do? You subscribe to the channel. Don't walk away from this channel of mine. Don't walk away. In this great future, we can't forget our past. No woman, no cry. Maje. I wish I had a guitar right now. Yes, sir. Who is in the house? As you come in, I can see Marge, I can see the coffee cakes, I can see Jamaican uncle. Me, I say J Hank in the house. Okwemba, my namesake, I can see everyone. My friends are here pampering, and our new friend Catherine here saying hi. Doctor, you play? Yeah. Eva, I wish I had a guitar. Take it. You see, the sun is fading away. That's the end of the day. Say that just to do like touch the moon, like I'll be on my way. Aye. Say that umusiani umunyore, you are something else. Injakai ninjiramba. Okamba, today I've talked in Bunyore language, and then you say, just to do like touch the moon, like I'll be on my way. Say it, just one kiss and I'll go. Say, I wish I could be near the coffee cakes. The coffee cakes, I wish I could be near. As you bring down the soprano, I'm doing my alto like, just to do like touch the moon, like I'll be on my way. Hey! Yes, I've told you I'm the physician who injects you with medicine and I give you enjoyment. So if you are new to the channel, this is a channel where you feel nice. Just hit the like button and subscribe to the channel. Tell me where you're watching from as we discuss our topic, heart attack, Hey, Okwemba is telling me I'm something else. Okwemba, how are you doing, my friend? I'm coming from, I come from Bunyore, the land we love. Bunyore is a little Jamaica in Kenya, Yeah. So let's talk about heart attack. As you come in, my people, as you check in, my people, tell me where you're watching from. If you're new to the channel, don't forget to tell us where you're from. This is where you feel nice and you learn and we interact. Yes, I've not got the hugs, man. I want you to give the coffee cakes hugs. The coffee cakes is back and she has been not feeling well. And when your sister, your brother, your mother, your uncle comes home after, you pamper that person with love. You tell that person, this is home. This is home. So if you are watching, pamper the coffee cakes with love. Let coffee cakes come back and feel this is home. Give coffee cakes some hugs, You guys, don't do that, man. Don't do that. I'm still waiting for those good messages for the coffee cakes. Yeah. Now, we have other types of heart attack, and before I continue with the other types of heart attack, what I want to tell you is heart attack is also called myocardial infarction, whereby myo means heart, muscles, cardio, the heart, infunctions, death because of oxygen deprivation. There is no oxygen, so the cells cannot metabolize, so they die off. So heart attack is just the death of muscles of the heart. Heart attack is just the death of muscles of the heart. So we have other types of categories of heart attack, how we can categorize heart attack in another way, And these ways are this one. We have the ECG, the machine, which gives us the waves. These ones, the ST elevation, but we have the other one, which is generalized type, which gives us the universal way, how we can categorize them without that machine. Yes, let's see how. And if you have a question, don't fail. This is a platform of discussion. Don't just listen. Ask questions and give up some ideas, some ideologies. Health matters is a matter of experience plus knowledge plus interaction. Experience plus knowledge plus interaction. Yes, my friend, I know someone is watching and laughing. Someone is watching, feeling nice and nodding. Continue nodding, my friend. This is Dr. Ben channel, and it is called Benjamin the Wise Guy. And if you are here and you're feeling nice, feeling irate, feeling that this is the place to be, hit the like button, my friend. Hit the like button. Don't forget to hit the like button. I wish my friend Xavier Man could be here. I haven't seen Xavier Man for some time, but I know Xavier Man will be around soon. No, there is the first one, which is called spontaneous heart attack. Spontaneous heart attack. This one also is the one that just you are there walking, you are doing your things, you are laughing with some people, and then something just comes and attacks your heart and you're down. It is called spontaneous heart attack. Refers to type 1 myocardial infarction, which occurs when the coronary artery becomes suddenly blocked. You know, when we talk and you see, it gives you some good knowledge. So, what are the coronary arteries? My friends, what are the coronary arteries? When we talk about coronary, they means the heart muscle. Coronary vessels. Coronary vessels. This one, coronary vessels. Coronary vessels. The ones when the blood is pumped to the body through, when the heart is pumping blood to the body, going to the body, the coronary vessels, they take some blood, they come back to the heart. They come back to the heart to help the heart get some energy. When they are blocked, when they are potentially blocked, when they are just blocked potentially, there is a problem that happens. Your heart does not get, and what happens here is very funny. What happens is you can be having plague. Plague is something that is building up in your something that is building up in your something that is building up in your vessel. Something that is building up in your vessel is what is called plague. So let me take this as the coronary artery. The coronary artery, this one. So cholesterol plaques, cholesterol builds up, and one day your pressure goes up, and then it is ruptures, and then it comes here and forms and blocks. So blood will not pass to go this side. This one means immediately blood has stopped. You start having issues, chest pain, because there is no oxygen to your, leading to formation of blood clots. Thrombus. Blood clot forms and the thrombus flows, and then you cannot feel, you start having chest pain. So according to something that is called universal myocardial infarction, or we say another name for heart attack is myocardial infarction. According to heart attack, universally, type 1 myocardial infarction or type 1 heart attack caused by primary coronary plague. Coronary plague is the blockage by a clot, a cholesterol, lipids, something blocking your vein. The vein that I'm talking about is this vein. The vein that I'm talking about is this vein. This artery that comes and serves your heart with the blood. Erosion or fissures resulting in thrombosis. Got eroded. So thrombosis means blood is not passing. Atherosclerosis develop. Cholesterol accumulates in the coronary artery wall. Inflammation causes plaque formation. Inflammation. The artery gradually narrows. The artery narrows. And when your artery narrows, it means no enough blood will go to the heart. And when it ruptures, the way I've seen, blood is exposed to the content. You form a thrombus. And the clot may completely block the artery. The clot will completely block the artery. And why are we talking about this artery? Artery. Every time we want to talk about this artery because it is the very important artery. Let me repeat about this artery. My cup of green tea must be here to give me some It's an antioxidant, so it's giving me some good vibes and good, Remember, my namesake has told me I'm something else. I am something else, and let me be. My friends, I will always repeat this because this is your heart. This is your good heart. You see how it is? This is your heart. Your heart that pumps blood, and not the heart of emotions. Don't tell someone you stole my heart, I'm in love with you. No. Those ones are some issues, but physically this is the heart, not the heart of emotions. No. The heart of supplying blood to the body is one, and it gives, as you supply blood to the body, you are giving your body oxygen and nutrients. So let's talk about this heart. Let's talk about, and this is my flask. Let me put my flask here, and this is my flask. So people, look here, my people. When blood is coming, when the oxygenated blood is coming from the vena cava here, it comes and drops here. We have the inferior and this one superior vena cava. So they drop. Its choir is here. Come on, big man, it's choir. So it drops blood to the atriums. The atrium, this one is deoxygenated. It does not have oxygen. You see, let me stand. It does not have oxygen. So what do you get here? The sinoatrial node, this one, the node, it does what? The cells here, positive cells of sodium goes inside the cell, and then it becomes positively charged. So when it is positively charged, you know what happens? It contracts. That's when we get the first P wave. Look at the P wave. You see where I've written P? Yes. So when it contracts, it pushes blood here. You know, as they contract, because this one, as it contracts, even this one is contracting. And why? Because we have this bundle here, this bundle that sends signal here. So normally, when it is contracting and it is pushing blood here, then we have the QRS complex. The Q, look here, QRS complex. Q, it means Q. This one signal has come and the heart is contracting. When the heart is contracting, it pushes blood to the pulmonary artery, which is going to the lungs to get oxygen. And as it pushes, also it is pushing blood to the outer to go to the body. You see? Blood enters, oxygenated, deoxygenated. And then you push, oxygenated goes to the body, deoxygenated goes to the lungs. You get those two things? So this outer, let's talk about the deoxygenated. Now, let's talk about the oxygen blood from this side, the red side, oxygen blood. Oxygen blood goes to the body, but part of it comes to the heart muscles through this coronary artery and the left coronary artery, which is divided into left anterior, left ventricle, lateral. You see, they have so many branches here. So this one, I'm repeating because this is the main thing that you need to understand. So when this coronary artery are blocked, these arteries that come back to the heart, that is where we have a problem. When these arteries are blocked, that is where we have a problem of coming back to the heart. Because if blood does not come to the heart, my friend, chest pain, your heart muscle starts to die off. Even you, if your legs does not get oxygen, they will die off, because oxygen helps metabolism, and blood, when it passes there, it gives their nutrients. So We have said that myocardial ischemia. Ischemia means lack of oxygen delivery falls to other parts of the heart. Muscles become ischemic. They have no oxygen, and then infarction, dead. If blood flow is not restored, the cells around there, they start dying. So the inner part is the one which starts, because it is inner part of the heart is away from the heart muscles than inside, away from the heart muscles than inside. So the first part, which is called the type 1 myocardial infarction, it is based on blocking of the coronary artery. You see, this is different. Heart attack is different from bundle block. There are some people who are given pacemakers. People who are given pacemakers, they have a problem with bundles. Bundles are the bundles, these green things you are seeing, these green things. These ones are the ones which pass the electrical system of the heart, making it easy to pump, making it easy to contract and relax. You see, to contract. So people that are put in pacemaking machine, just know they have this problem with this, or they are born with another additional point, firing point, which is the Kent bundle, somewhere around the left atrium here. So when this one hits, it gives a nodal non-return electrical system, NNRT. They are called nodal non-return tachycardia. So yes, today we are talking about types of heart attack, and the first heart attack we have talked about is types of heart attack or cell death in the heart attack is called myocardial infarction type 1 due to atherosclerotic plaque. And this one mostly is cholesterol accumulates. This is how it happens. Cholesterol accumulates in the coronary artery vessel. Inflammation causes plaque formation. Inflammation. If you are, inflammation inside the vessel means swelling. So the artery swells and gradually narrows. It's where I can see you. Big up every time. It's where I can see you in the house. And then we have plaque rupture and erosion. So when the plaque is built up and it ruptures, this is step 2, it breaks. Blood is exposed to the plaque contents, and it starts to form a thrombus, which is a clot, and then it blocks the vein, and then the other end does not have oxygen, and even blood is not reaching there. If blood is not reaching anywhere in your body, just know that place will die off. Just know that place will die off. Now, we have risk factors that can make you be, and we have gone through these things are universal to every type of they are in every type of what is called what? They are in every type of heart attack or myocardial infarction. So non-modifiable, you cannot modify your age, you cannot modify your sex, you cannot modify your family genetic makeup, and you cannot modify your family history of these problems. They are genetically intertwined. But what you can modify is your lifestyle. You can stop smoking, you can take drugs to reduce hypertension, hyperlipids, lipids I mean cholesterol. You can stop smoking, and you saw what smoking does. Smoking, excess alcohol intake is equals to excess destruction of your liver and some cells. So obesity, we talked about it. We talked about these things at large. You remember them. Chronic kidney diseases, releasing renin every time, and chronic stress every time. This becomes a problem, my friends. Symptoms, what are the symptoms? Typical symptoms: severe chest pain, pressure, tightness, squeezing, and heaviness around the chest, and pain radiating to the left arm, jaw, shoulder, back. All these are symptoms. And you can get shortness of breath, sometimes sweating, dizziness, palpitation, anxiety, or feeling of impending doom. Have you ever had someone, you are talking to someone and this person is telling you, what are you telling me? I'm not feeling okay. And then this person becomes like psychic at times. It is feeling of impending doom. These are typical symptoms in older people and women and people with diabetes, This may include fatigue, indigestion, epigastric pain, breathlessness with chest pain, and syncope. Syncope is lack of enough oxygen in air. So that is type 1 myocardial infarction. It is called type 1, a spontaneous myocardial infarction. Or let's say we call it what? Type 1 or spontaneous. There is another one which is called type 2. Type 2 is called supply-demand mismatch. Supply-demand mismatch, type 2. So that one is spontaneous. Spontaneous means you have a lot of cholesterol that are piling in your body. Hillary is here. Hillary outer Qatar. Hillary, how are you doing? Hillary, sometimes working hours and this type of, makes us not to reach each other, my friend. But I know you are doing good, and we are still talking about heart attack and sensitizing people about issues concerning heart attack. So, type 2 myocardial infarction, supply-demand mismatch. Supply-demand mismatch. And why are we talking about supply-demand mismatch? Listen to this. Myocardial infarction is caused by imbalance between the oxygen supply to the heart and oxygen demand without acute coronary artery rupture or thrombosis or plague. That is, Hillary is from Nairobi, Dr. Ben. Oh, Hillary. When I look at you, you look international. You look international, and you need to say amen. Hey, Hillary Yegon, you need to say amen. You look international. So when I say Qatar, US, Hillary from UK, you say amen. Big up, bro. Hit the like and feel good. Big up, bro. Hit the like and feel good. Nairobi is the capital city of Africa. Very nice, very nice, very nice, Hillary. Very nice. That is true. The capital city of Africa. I will not finish that. So if you are watching me, you're still here and feeling good. Ask me a question. Don't just feel good and and sometimes you scroll and go. Don't do that, man. Don't do that. Don't scroll and go. Don't scroll and go. What you do is you come, you watch, you subscribe and you hit the like button. You come, you watch, you subscribe and you hit the like button. Okay? So this is type 2. The other one, the first one was the coronary arteries are blocked. Blood is not going through the heart vessels in a good way. Now, this is the second one. Mismatch. Type 2 mismatch. Coronary arteries supply oxygen-rich blood to the myocardium. Myocardium are the heart muscles. So, oxygen supply matches myocardium oxygen demand. That is normal. But in type 2 MI is called heart attack, myocardial infarction. Oxygen supply decrease, oxygen demand increases. The oxygen supply decreases. Blood is there, but oxygen supply decreases. But the demand You need more oxygen, but it is decreased. You get that? Or both. And you know what can cause that? Blood is going through your heart very well. Very nice. Blood is, as the heart pumps, blood goes from the coronary artery, comes back to the heart muscles. The heart is still pumping. The heart is still pumping very well. Eh? But what is the problem? If the heart is getting enough blood, what is happening? This is called type 2 heart attack. Type 2 heart attack. Type 2 heart attack, the condition that reduces oxygen demand. My people, one is anemia. Reduced oxygen means less oxygen is delivered to the heart. You can have your blood vessels, all of them are good, that goes to the heart, but you are anemic. Hemoglobin is not enough. Your heart will not get enough oxygen. Then you start having, You see, that is different from the other one, which is stopotentious. Your heart vessels are blocked. This is the other one, type 2. Yes, you get that. You get that? Anemia. I know you have started giving yourself some 1, 2, 3. You have started adding notes. Adding notes. Anemia is one of them. So the other one can be what? Pneumonia. Pneumonia can make you have heart attack. Yes. And people say, sometimes you can be in hospital, you receive a very learned patient. A patient who has read books, a patient who has Googled very well and asks you, doctor, here in Kenya doctors are called daktari. Why have you not done any test and then you are saying I have pneumonia? My friend, pneumonia is a word that only means lack of oxygen. Pneumonia. Pneumo, air, near, lack. Pneumo, air, lack of oxygen. Yeah? Do you need to do some tests so that you can know this person has pneumonia? Medically and clinically, you can analyze that person, you check the chest, you take a pulse oximeter, this is a pulse oximeter, this one. So let's see let's check my oxygen levels. You press here, let's check my oxygen levels. Is someone seeing it? Check my oxygen levels. It will show you right now my oxygen levels. Hey, my friends, I'm very healthy. Let me put a light so that you can see. Check my oxygen levels. 92, 93. So when you just use this, and you see a person has fever, a person has chest in drawing, struggling to breathe, and oxygen here are less than 85, you quickly know that this person has pneumonia. And the heart muscles may not be getting enough oxygen because the blood is going, but they are not carrying enough oxygen because your lungs have a problem. You see now you have started learning 1, 2, 3 things about heart attack, and that's why you can see people collapsing when they have pneumonia. So that is pneumonia, lack of oxygen. You see, my guys. So mine is okay. You have seen mine is 92. I'm doing healthy. I'm doing okay. So pneumonia, infectious pneumonia like bacterial pneumonia, fungal pneumonia. There is another one, viral pneumonia. There is another one, chemical-induced pneumonia. Those, all of them, only making you not get enough oxygen to your lungs, to your heart, can make you have a heart attack. Something else that is very important, and I'm saying seriously. How do people say things seriously? Hey, yeah. How do people say things seriously? pulmonary embolism. Check. Pulmonary means the circulation of the lungs. Pulmonary embolism means circulation of the lungs. Pulmonary artery to the lungs. It is called pulmonary embolism. So it means somewhere from the pulmonary valves, from the right heart side, going to the pulmonary artery to the lungs, somewhere there is something that is blocking. Yes, Agnes Thomas, how are you doing, my friend? Agi. Agnes Thomas, which country are you coming from? Please tell me today. I forgot. Tell me today. I want to sing you a song. Sing me a song. Desert Channel. Greetings, Jamaican Uncle Bless Up, Marcia Thompson. Good morning, Benjamin, and everyone. Good morning, Marcia Thompson. Marcia, hey, I've spent all my life with you. All my life. That is a big tune from Marcia. Hey, Marcia from Jamaica. So Marcia is a good name. It's a name of good people with big names. You know, Marcia. Hey, I've spent all my life with you. All my life. Yes, Desert Channel. When are you inviting me to the desert to see the heat and be heated with the heater? And Agnes Thomas tells me she comes from Granada. The land. I think Granada is the land of. Is it an island or what? I'll check it up. I saw hello from South Australia, Chantidi. Chantidi. Let me welcome my people before I continue with the heart attacks. Let me welcome my people. So, Chantidi, hope you have subscribed to this channel and interact with the people. If you have a channel, tell these people that I have a channel and my channel is called Chantidi. I cannot spell the South Australia. South Australian guys here, my friends. I can see more people coming in, and let me check in and big up some people like Jamaican Uncle, always big man in the house. Let me big up Chantiari, where are you coming from? Which country are you coming from? Hope you have subscribed to the channel, right? Hope you have subscribed to the channel and you're doing good. Bless up and blessings to everyone. Jamaican Uncle loves Gregory Isaac. You know, here in Kenya we call Gregory Isaac Gregory Waithaka. Marcia Thompson, big up every time, Marcia Thompson, for your support and being here. Yes. Let's check around again. Agnes Thomas from Granada. Agnes Thomas, big up every time, and if loving you is wrong, I don't wanna be right. You know that song? If loving you is wrong, I don't wanna be right. Go and search for that song. I know some people know it. If loving you is wrong, I don't wanna be right. This is where we learn and we learn and we feel good. No learning. Listen to this. Listen. Jamaica. Gregory is my boy, Dr. Benjamin. Yes, I know. Listen to your boy. Listen, Jamaican Uncle. Yeah, Dr. Ben, you're hitting some. So other men will be give you diamonds and all I had is love. Say, darling, all I had is love, Jamaican uncle.
So give it much to ever stop lying.
I love you too much to ever stop liking you, my people. Eh? I love you too much to ever stop liking you. So, doctor, don't give me a step not to be your friend. I love you too much to ever stop liking you. Every new person that comes here, make sure you're hitting the like button. Do it, my friend. Hit the like button. Agnes Thomas, I usually see you supporting every friend of mine. Please do it. Fighter for the positivity, even to my big man, Marwa himself. Now enjoying some vacation out at the coast. Look at Marwa. Jamaican uncle is here. Please see Jamaican uncle as he's in the US, outer somewhere called Jamaica, the lovely land. So if you have a question about heart attack, it is your time, you can ask. But right about now, we were talking about the second one, which is called second MI, which is the second part. The second part is called supply demand mismatch. Yeah? All your veins are okay. There is nowhere there is a blockage. The coronary arteries are passing blood the way they are supposed to be passing blood. But what may be the problem? My people? Pneumonia, COPD, exacerbation. See, chronic obstruction pulmonary disease. You are always coughing. Yes, as you cough, it means your airway is being blocked. Embolism. Pulmonary embolism means the pipe that is supplying blood towards the heart, the pipe that is supplying blood towards the heart. I want you to see this. The pipe that is supplying blood towards the heart, somewhere to the lungs. This one, the right side, blood goes to the heart, to the lungs. Somewhere there, it is blocked. So, if it is blocked, what does it mean? It means no way enough blood will go to the lungs. And so, no enough blood that is coming in with oxygen. And then, your coronary vessels do not have enough oxygen. You know, you are learning and you are feeling nice. Learning and feeling nice. So that is the second, supply demand. Your blood is okay, but the oxygen that is being supplied to your Dr. Ben, enough respect. Always big up and respect to Agnes Thomas. Agnes Thomas. On Sundays, we usually have a live on Jamaican Uncle channel, 9 p.m. Georgia time. 9 p.m. Is it 9 p.m. Georgia time? Around that. Please come and we chat. We usually have a live on StreamYard. Please come there, Agnes Thomas. We talk, when you talk to people live, you feel nice. You feel nice looking. The other time I saw Barry walking exercise and I saw Hilda Taylor and I really felt nice. I feel nice looking at them and talking to them, So Agnes Thomas, join us there. Dr. Ben, I'll be there, God willing. Thanks. Desert Channel, hello brother from another mother, village. But you guys, some of you have channels and you're not giving them shout outs, and some people are just coming, new people are coming and watching, and they'll come again and watch, and you are not giving your channels shout out. Yeah, okay. Big up Jamaican Uncle, everyone who is watching, please go watch Jamaican Uncle, go watch Jamaican Uncle channel, go watch Desert Explorers, everyone is sure, go watch the Coffee Cakes, Loving Beach there, Kwemba, everyone that is in the house, go watch these people and give them the good salute, advise them on good content and tell them you're doing a nice job, but here you can change, never fear criticism because it gives you a challenge when you are growing up. So if someone comes to your channel and tells you, here you're doing this and this, please do it in a better way. Embrace it so that you can have a challenging mind to grow and give good content. And you know, when you give good content, what people do, they come to your channel and the growth is there. And of course, when you grow, what happens? Money comes in and you smile to the bank. Maro has given me more adjectives, smiling to the bank. So you guys, don't fear criticism. Sometimes let them come in a positive way. So we have said supply demand. The second one is severe pneumonia, chronic obstructive pulmonary exacerbation, blockage, pulmonary embolism, and respiratory failure. Hypotension or shock. The shock is not the electric shock, the one that you go and touch a live wire, then you kind of like, no. Shock means you can have a septic shock. You can have an infection and you are hit but by shock. You are dehydrated, you get shock, you can't do anything. Hypovolemic shock means you don't have enough volume of blood. You are bleeding and you have shock. Cardiogenic shock means your heart, cardiac muscles have stopped working and they are under shock. So they cannot pump blood as needed. So shock can make you to have cardiac arrest. You know, supply demand is not okay. Coronary artery spasms, temporary narrowing of the coronary artery. Artery reduces blood flow. Narrowing, spasms. Infections can make you to have spasms. Cholesterol plagues can make you to have spasms. You know, coronary artery dissection, tearing in coronary artery wall reduces blood flow. When you are bleeding internally, your artery has teared, blood flow reduces. You see. But don't just watch me, my friends. If you have a question, please hit me with the question. Give me that question. Give me that question. Who has a question? My friends, who has a question? Please give me the questions. Let me listen to your question. Let's advise each other. There are conditions that increase oxygen demands, like tachycardia, the heart beating so fast, hypertension, the heart pumps against pressure, fever. Fever raises metabolic rate and cardiac workload. Doc, my cousin is having frequent palpitation and did an ECG and is given Cavedirol by the doctor. Is that a blocked artery? Do you want my guys to repeat that question? Cavedirol in the same platform with. In the same sentence with, let me repeat that again so people can hear it. You know, some people watch but they don't read. Majebi says, my cousin is having frequent palpitations and did an ECG and is given Cavedirol by the doctor. Yes, Maje, not necessarily. Palpitations alone do not mean a blocked artery. And the fact that your cousin was prescribed Cavedirol does not indicate coronary artery disease. It doesn't. The fact that, what are palpitations? Let's learn from there first. I'm answering Marjay B. Palpitations are a racing heartbeat, a pounding heartbeat, fluttering in the chest, skipped or extra beats. Let me repeat this. Look, this is normal. Let's take this as normal. This is slow. That is slow. This is faster. This one is exaggerated. So that one is called flutter. The heart beating like that one is called flutter. even blood is not flowing. This one is tachycardia, faster. This one is normal. This one is low. Get that point? So palpitations are called by racing heartbeat, pounding heartbeat, tachycardia, skipped extra beat. They can be many conditions, including anxiety, extra caffeine, releasing adrenaline, alcohol or smoking, hyperthyroidism, anemia because of demand and balancing, electrolyte imbalance like sodium and potassium, heart rhythm disorders, they are called arrhythmias, tachycardia, bradycardia, the ones that have been, certain medication. So the ECG diagnosis of a blocked artery may not suggest it, So cathedral usually have anxiety. You've answered us. Yes, you've answered that. Palpitation are caused by anxiety. Cathedral is a heart block tablet. It makes the heart muscles to reduce the beat, So because she has anxiety, it is the reason for palpitation. So go to the mental health playlist, share to your cousin anxiety disorder management. It will really help her. That one will make her even not to take those cathedrons. You deal with the problem. Anxiety may be non-neural development problems in mental health, but it may cause hypertension and heart problems. So that is the cause. Cathedral only helps the symptom, which is slowing the heart rate, the heartbeat. You get that, my friend Maje? Your Kuzo, your cousin, here we call them Kuzo, only needs relaxation. Relaxation! Yes! So we are talking about the second one, and we have said several things about supply, demand, and we have said that pneumonia, COPD, chronic obstruction pulmonary disorder, respiratory failure, and other things that can make you have heart attack, oxygen not going to your heart, septic shock, hypovolemic shock, cardiogenic shock, coronary artery spasm, coronary embolism, coronary artery dissection can make you to have these problems. There are some conditions that increase oxygen demands, like tachycardia, hypertension, fever, hyperthyroidism, we have said it, and intense physical exercise. Those ones can make you to have problems when it comes to oxygen demand. We have 5, and we have just dealt with 2. I think we add 1, then we call it a day. I can introduce 1, then we call it a day. So, my friends, that is how heart attacks come. Under diagnosis 1, we have said we diagnose them under, we check if the ECG is telling us ST elevation. Second, we diagnose them as general, spontaneous, and oxygen demand. Those 2, so that we have discussed. Now, we have another one. That one is supply demand. We have another third one, heart attack, which is called sudden cardiac death. Hey, will I do that right now? I don't like talking about that. The patient dies before the test to confirm elevated biomarkers. No. I think these ones we will do them on another Sadian, but I can introduce it. You see. So, hi, best friend Ricardo Maldon. Ricardo, how are you doing? You gone so long, man. How are you doing? Ricardo, Say hi to everyone in the chat. Say hi to everyone in the chat. My friends, Ricardo is in the chat and is a good friend of ours. Hope, Ricardo, you have subscribed there. You know, when you subscribe, it gives an impression. Just like how we sing, Rastaman throw one stone, say, and it gives about a feeling to wicked men. One stone, Rastaman throw one stone, and it gives about a feeling to all wicked men. So we have dealt with those two. The two one is very important. It is 9:48 a.m. from Jamaica. You are one love and your family. Yeah, Ricardo, thank you so much for that compliment. Thank you so much. Ricardo, let me read what Ricardo has said. Ricardo, hit the like button and let's move on. Let's move big time, and share this content, my friend. I think right now we should be hitting 2,000, 3,000 and more. If you share, we will go on and go on. It is 9:48 a.m. from Jamaica, and you are a nice one, love, and our family. Thank you so much, Ricardo. Thank you so much for that compliment. I thank you for acknowledgement. Acknowledgement is a good thing. It gives you the heart to continue and continue and continue. So let me ask this question, because I'm gonna do those others at another time. I will do those others at other time. What do you think generally a higher percentage of people get what? How can I frame it? What do you think in a higher percentage of people gives heart attack? Which percentage of high percent of people get what causes heart attack in a higher percentage of people? What can we say? What causes heart attack in a higher percentage of people? What do you think? Nowadays, let's not talk about the journals. Let's not talk about the journals. In a higher percentage of people, what causes heart attack? Many people who get high heart attack. Many of the people who get heart attack, what makes them to have heart attacks in a higher percentage of people? You can all those things that we have talked about, they may give someone a heart attack. But what gives a higher percentage of people heart attack? It is important to know, so that we avoid. Medicine is a evolving and something that is growing daily and daily. Medicine is something that as we get new drugs, as we are struggling to get new drugs, evolution of more bacteria and viruses come in, and more damages to the same problems that bring complication, they still remain the same, or they become harder to treat, So the heart attack will only remain heart attack. But the things that brings these heart attacks, what are they? What are these things that bring these heart attacks in a higher percentage of people? So if you know or you can guess, please hit the I want to create a poll. Hit the chat and tell us. I want to ask people, have you ever experienced or seen a person with heart attack? I'm creating a poll. Yani a question of yes or no. A question of yes or no. Yes or no. Those are two options. Have you ever experienced or seen a person with heart attack? A question of yes or no. So, guys, you're not answering me. Let me see. Let me see here. Who is answering out? I've linked this YouTube to some. So when I'm talking here, some people are listening the other side, and I'm trying to scroll there to see the questions that they are putting up. So, have you ever experienced or seen a person with heart attack? Or the other question is alcohol and drugs. Yes, Maje has said alcohol and drugs. Alcohol and drugs. Nowadays, people drink a lot, right? Nowadays, people do drugs a lot and drink a lot. Why? Because of stress. Is it stress-induced or what? When you take a lot of drug, you increase the chances of getting cholesterol and lipids. Cholesterol and lipids. That one may be a correct answer. This is the buildup of cholesterol and lipids. So the cause is that alcohol and drugs. Drugs like cocaine can get you a heart attack. Drugs like heroin, drugs like there are so many drugs that people abuse, including prescribed drugs, including anti-anxiety drugs like benzoxils that people use that are prescribed in the hospital. They may cause heart attack. This is the buildup of fat through taking a lot of alcohol. If you take a lot of alcohol, you'll get fatty liver. And fatty liver, you will start having something that is atherosclerotic plaque. Now, the most common cause of heart attack worldwide is called coronary artery disease, atherosclerotic, which accounts to 90%, imagine, which accounts to 90% of myocardial infarction. This is the buildup of fat, cholesterol, inflammatory cells. You know, when cholesterol builds up in the system, when cholesterol builds up in your vessels, they create inflammatory cells coming there and calcium. And you know, even the kidney stones, what they do, it's calcium accumulation with fats, causing something that is called, yes, doctor, especially the younger generation. Yes, my friend from South Africa, our friend Beauty, told us in South Africa, youths are really drinking. Youths are drinking a lot. Welcome, everyone. I can see some new guys checking in. If you are new to the channel, don't fail to subscribe to the channel and like. Yeah, let's increase the likes. If you have not liked, let's get to 20 something. Let's increase the likes as we go on with the talks. Increase the likes, hit the like button, double tap your screen, man, if you are watching me. Yes, so when LDL, the bad, you know, we have cholesterols that are good and bad. So low density lipoprotein is a bad cholesterol because it sticks in your arteries and your blood and your body. But we have something that is called the high density lipoprotein. High density lipoprotein that clears the low density lipoprotein, carries it away from your vessels, and triglycerides. So triglycerides are hard cholesterols. So those ones, when they go to your bloodstream and they get there. And when they get there, what happens? They form something that is called a plaque. The plaque becomes unstable and ruptures. I've explained that when I was explaining atherosclerotic plaque. And the major risk to these people is, one, Maggie has told us, alcohol intake and what smoking, high blood pressure, stress. Nowadays people have depression, a lot of stress and depression. A lot of here in Jamaica also. Oh, okay. Wow. So these things, they build up. You form fatty livers, you form cholesterol in your body, you form everything that is circulating, getting to your blood vessels. And I will repeat the risk factors. Increase in age. As you increase in age, you need to check your nutrition. Male sex, rise risk earlier in men after menopause. Women risk increases. So male sex, check on yourself. As you age, do exercise. Family history, genetic predisposition. If you are family genetically, you have issues with the heart muscles, problems. But you see, there are some things like smoking. Smoking always promotes clot formation. And it promotes clot formation. Why? Because it stops the anticoagulants, natural anticoagulants in your body, and gives your body something that is called free radicals, cancer markers, increasing atherosclerosis. So don't always do things feeling you are feeling nice. Don't do things thinking that you are feeling nice. You know, you have to do things in the right dimension. Right dimension means don't be carried by peer pressure. Don't be carried by whatever you think is you're feeling nice. How can I call it? Something that you urge. You have the urge to be doing every time. Don't be carried by them. Check on the future. If you are a parent, if you are Dorothy, someone is calling that he has gone. Calling, then he has gone. You see? So if you are coming in, I know some people are coming in and they are wondering what I'm doing. Just know that this is Benjamin the Wise Guy. The channel is called Benjamin the Wise Guy, but I do talks. Medical talks, and also come to the channel and interact with the people that are here. Get interacted with the people that are here in the channel. Ask them some questions. So smoking, there are some people, yes, there are some people that if you tell them stop smoking, they'll tell you I can't stay without smoking, I don't feel good. So let me ask, if you don't feel good by not smoking, and then you end up getting myocardial infarction, something that is called endocarditis, you rather don't feel that good and you live with it, and you live longer without complication and drugs. You go to a doctor, the doctor, I've met some people, they come to hospital, you give them antihypertensives, and they tell you, I don't feel like taking this medication. The next time you visit, you see them, they are in the hospital, not even able to walk. Cardiac arrest. High blood pressure, drugs, not following doctor's advice. Let's talk about nutrition, nutritional care. Let's talk about nutritional care. There are milliliters, uncontrolled sugar levels, obesity, Physical inactivity. You don't like even walking. You have a car, you have everything. In your house, you are done everything. You are a CEO, not even doing anything. You see what I'm saying? You see what I'm saying? Unhealthy eating habits. Excess alcohol, just like Maje has said. Heavy intake can raise blood pressure and contribute to heart diseases and even cholesterol. Chronic stress can increase blood pressure, So, the most common cause of heart attack in a person is atherosclerosis caused by cholesterol. And those things that cause those cholesterols is genetics, because there are some people genetically they have a lot of cholesterol production, the bad cholesterol. And there are some people, their lifestyle is very bad. Your eating habits are not good and you don't like exercise. Junky food. So you see that. Don't take junky foods feeling that nice, feeling the sweetness. I said, feel the sweetness and life has a balance. As you feel the sweetness, yes, Jay Hank, thank you so much for being here. As you feel the sweetness, feel the pain by exercising and hitting the gym. Life has a balance. Feel the sweetness, reduce the calories. Feel the sweetness, reduce the calories. Or balance your eating habits. Two things. Drink the alcohol, know that you're gonna get a problem. As you get high, feeling nice, singing, I wanna get high, so high, I wanna get high, so high. Just know another thing is what is coming to hit you, So as we continue, 3 minutes to go. Wow. Now, anyone with any question you have, anyone with any question, before I call it a day, it has been a very good session and we have learned a lot. We have learned a lot of things here. We have learned some things that are important. Yeah. Anyone with any good question? Anyone with any good question? Before my time lapses, it has been 1.5 hours of pure niceness. I call pure niceness because we are learning while interacting and talking to friends. It's such a good thing when you are learning with your friends. Such a good thing when you are learning with your friends. You don't know how to love me. I'm waiting for any last question. And as I'm looking at some questions here on it, some questions that are coming. Someday, someway, Yes, I've really talked today. And I think some people are still here watching. Still here watching. So if you have a question, it's your time to bring it so that we can all learn. Anyone with any question or anyone that is you are here or you want to meet the doctor and you are around Kenya, you can meet me if you want. I can give my secretary your booking and then you can meet me. A booking, then you can meet me. Yes, The day has been cool. I think we have come to the end of the session. If you ever have any question, just email or send to the WhatsApp number that is always here. So you guys, let's meet to the next session. As we say, one love, one heart. Big up yourself all the time.